Welcome to the Propreneur Podcast, where we help practice owners become better entrepreneurs. I'm your host, Dino Watt. Welcome once again to the Propreneur Podcast. I'm your host, Dino Watt. Excited to have you listening in today for another episode that I believe is going to help you incorporate the best practices possible inside of your practice. As you know, as our goal here for our show is to help you learn all the things they never taught you back in school and how you can improve as a business owner, as an entrepreneur, as a leader of your teams. And today is no exception with the amazing quality of guests that we've been having. We get to have, not only is this person an author, they are our previous CEO. There's someone that talks on one of the most important subjects I believe you can talk on, which is communication. Our guest today is Burl Stamp, who has one of the coolest names ever, by the way. And this is coming from a guy named Dino. I mean, come on, I like names. But yeah, Burl Stamp, welcome to the show.
Thank you. It's great to be with you. I'm thrilled to be with you and to talk to your audience.
Now, come on. Now, Burl is one of the coolest. Like that's like, I think cowboy. I think like tough dude. Where is there a meaning behind the word name Burl?
Family name, actually named after my dad, and he was named after a great uncle. And everybody thinks cowboy or South or whatever. The reality is the name actually is British.
Really?
It is, yes, indeed. So
wow, I get the same thing. People, oh, it must be Italian. I'm like, well, I'm actually Greek. Sorry, it doesn't. But anyways, I like unique cool names. I will never forget your name. That's what's cool about it, right? It's like people probably don't have a hard time remembering it. That's good. Right. Well, we're glad to have you on the show. Burl, let's give a quick introduction to who you are and what you do and why you're going to be an amazing educator on this show.
So I have a consulting practice based in St. Louis, but we work with health systems all over the country and even occasionally internationally. Nice. And we work at the intersection of employee engagement and patient engagement and how those influence one another. And they absolutely influence one another.
For sure.
Prior to starting my consulting practice 16 years ago, I spent lots of time inside health systems. I was the CEO of Phoenix Children's Hospital, which that experience, I learned so much from the team there, and it helped influence the work that I do today. And then also spent 9 years with BJC Healthcare here in my hometown in St. Louis.
So listen, as a CEO, you've seen a lot, especially when it comes to HR stuff, when it comes to teams and leadership, right. Lower management, upper management. So what an insight that I think you're going to be able to give us today. I was taught years ago, and some guy was giving me some philosophy around that, the difference between, entrepreneurs, their job is to be more creative, whereas CEO's job is to be more strategic on how to do that. So talk to me a little bit about your strategy as a CEO, what you felt was the most important part of your role as a CEO.
It was really supporting the staff. It was up and down the organization. And because, great strategy is fine on paper and it sounds really, really good, but if you can't get the organization to embrace it and you can't support the people who are actually going to carry out that strategy, it really does you no good. So I am absolutely a believer in the cliche or the trite phrase, or culture eats strategy for lunch. The culture of the organization is the driver. And if you have a great culture, what I found, I can tell you countless stories of where I've been humbled by what frontline staff have done for patients and families, have done for the team overall. So if you create that culture, staff will do amazing things for patients and they'll do amazing things for your organization.
I 100% agree. I was at an event recently where people were talking about kind of the trifecta of your business, and this one person, and she was very well-intentioned. She was a new speaker and she's a consultant, and she puts up this triangle, right? And she's like, so what's at the very top of the triangle, everybody? And everyone in the audience says, the patients. And I was sitting in the audience wanting to stand up and scream and say, no, like it's not. Yeah. Like if you create the team will take care of the patients, and we need to really put a lot of their focus on those patients. So your focus has been around that communication and effective communication for those better teams. And by the way, I love that you're using the word team, right? It's about us winning or losing together. So Why did you decide to transition in from the CEO space to the consulting space?
Well, there had always been an entrepreneur, I think, inside me fighting
Nice.
to get out. And if you look at even my path inside large organizations, I think I did some reasonably entrepreneurial things inside large organizations. But I reached a point where I really wanted to do something on my own. But more than that, my experience at Phoenix Children's Hospital really taught me that we had a lot of work to do in how we engaged with staff, how we supported staff. At that time, the idea of patient satisfaction was becoming much more, this was way back in the late 90s, early 2000s. And patient satisfaction was becoming more and more important and was transitioning to patient experience. But I was a little bit frustrated with some of the tools and approaches. I thought they might work in the entertainment industry or they might work in retail. You know what? Healthcare is different. The challenges are much, much more significant. And the research at that time was really beginning to emerge that said interpersonal communication is absolutely the driver in terms of patient experience. So when I started my firm, we really focused on how can we really help develop interpersonal communication competencies with staff, not just script, I hate scripting, not just implement tactics, not just, just say this. No, it's not about just say this. It's how are we really listening to the patient and family members, and how are we truly communicating with them, not communicating to or at them. So that was the genesis. And working with frontline staff taught me a lot. It taught me that we could do a better job and a more respectful job in helping them be at their very best.
Well, it's so funny when you say that about the scripting thing, because it just brought me back to, it wasn't in a medical situation, but we were at a hotel, I think it was. Yep. Oh, that's right. We were picking up my daughter. My daughter had served a service mission down in Dominican Republic. And at the hotel, there are some challenges going on. And we were trying to get their service. And the person across the desk from us kept saying what they were supposed to say. And you totally pick up on that script, right? You're like, okay, I get that you are supposed to say this right now, but what I want you to do is something different. And having that interpersonal skill is so vital. Yep. It's interesting to me, and I don't know if I'm right on this or not, but I'm thinking that during this time frame that you're talking about of being at the Phoenix Children's Hospital and developing all this, there wasn't really a lot of focus on EQ. Right? The emotional intelligence when it came to hiring and stuff. So that's what you were really doing.
Yeah, absolutely. You are both in the hiring process, the recruitment process. Yes, you are considering EQ, but then when staff join you, you're developing EQ. You are really, because these aren't exact percentages, but among staff, I've always found, 10 to 15% of your staff are fabulous. They're just wired to connect.
Yes.
And their emotional intelligence and how they, there's probably 10% or less at the other end that maybe chose the wrong profession. But there's this huge group in the middle, about 80% or more, that are really dedicated, committed, but need some help. Like we all need help in lots of areas in terms of developing and really honing those skills and really bringing those skills out. And that's what we work on.
Well, understanding that piece, that middle piece, and understanding that your role as a leader is to give them that guidance and show them what you want, and understanding that they just don't think of it that way. I had a doc once call me and complaining about our team members, and at one point say, well, man, I just wish they would think like me. And I said, well, you know why they didn't, or they don't think like you, is because they're not doctors.
Right.
They would have gone to medical school.
That's
it's like, you got to understand your job is to give them the things. And by the way, most of them, like you said, that middle part, I believe as soon as they learn it and you show them, they're, oh, okay, sure, I'll do that.
Exactly.
That's so important.
And there's a lot of different ways to do that. Job one is modeling the communication competencies that you want. We say this in lots of different ways. Staff watch the walk lots more than they listen to the talk. They model, and whatever it's like good parenting. Whatever they see is what you get. So we work a lot with middle management teams, which middle managers have the toughest jobs in the place. They get pulled in lots of different directions. They get pulled from the top, they get pulled from the bottom, they get pulled by patients and physicians and everybody. So really being respectful of them, but helping them build not just their own interpersonal communication competencies and EQ, but how to develop that and support that and mentor that in the teams that they work with.
Well, let's go into a little bit of that right now, because you're the author of a book, The Healing Art of Communication. And in there, you've created some processes around care communication. Did I say that right?
Right. Yeah, that's the curriculum that we've developed, the robust evidence-based curriculum that we've developed. And at the heart of that is really, I work in healthcare, so it has to be an acronym, is the CARE. So CARE stands for compose, acknowledge, respond, and evaluate. And so briefly, when we go into into a conversation, because we're all juggling a lot of stuff all the time, every day, every second, but we need to go in a focused, composed, present way for a conversation to be most effective. Then when we do that, the acknowledge piece is the back and forth. It's the active listening. It's making sure we really understood, we heard and we understood what the other person is trying to tell us. Not just facts, figures, but emotions, what's happening. So the acknowledge is acknowledging where that other person is and helping them acknowledge where we are. If we do a good job with that, then we respond more effectively because we pay attention most to what they're most concerned about, what they're confused about, what they're fearful of, the things that matter most to them, and respond. And then the E is like any good model. Is it working? Are we getting through? Are we connecting? Are we creating the communication we need? If we're not, what do we need to adjust to do better?
So what is E?
E is evaluate.
Evaluate. There you go.
Yeah.
I was going to write them all down so I can repeat them later on for you. So that I love that you start with compose. I use this saying often, right? The higher the emotion, the lower the IQ. And to know that you got to start off with just being composed and focused and being present and having that acknowledgement part of it. There's that saying, most of us listen to respond, not listen to understand.
That's right.
And
exactly right.
Here to be able to know that you are having that process, CARE, compose, acknowledge, respond, and evaluate. It just makes sense to have a very simple process to help me check off the list to make sure that I'm going through it correctly, which, by the way, I think our brains love order, right? It loves to know, I go from step 1 to step 2 to step 3. Awesome. Right. I can accomplish that thing.
They do. That's right. But I also tell folks in the model that it's not a completely linear model. We always start with the compose piece, but then we weave in and out of acknowledge and respond. So they acknowledge, I understand that you're concerned about the medication that you've been prescribed. Well, so let me give you some additional information on that. And then we may weave back to acknowledge around, well, you're also concerned about the wound care plan or whatever it is that we're talking to. So it's an in and out in terms of, and how are we monitoring where that other person is? Predominantly by the nonverbals. When we watch the nonverbals, we get a window into how they're really feeling about something, what they really understand, what they're confused about, what they're scared about, and we use that to acknowledge that and then respond appropriately.
That nonverbal part of it, right? The body language, the tone, it's some of my favorite stuff to talk about because it tells us so much more, right? Someone say yes to you with the words and they're not saying yes to you. You're not listening to it. Well, I would love to understand from your perspective then, and by the way, I love that weaving in and out. I think almost everything we got to look at it is how are we just getting through the motions or going through the process, or are we making sure we're capitalizing on that one thing before we move on to the next step?
That's right.
I would love to hear from you. Where do you think most people, especially in the leadership positions, make the biggest mistakes when it comes to communication?
They equate communication with message delivery. And message delivery is only half of the equation. And I would argue it's the least important half. what's the book? Everything I Need to Know I Learned in
In the
Kindergarten.
kindergarten, yeah.
Your kindergarten teacher, you have two of these and only one of these for a reason. And so the listening part, the really listening, the active listening and really connecting, I think is where we have the greatest opportunity often. Just stop talking and listen to your staff. They have phenomenal insights into things. They have important ideas. They have important questions. And if you really want to support them most, pay attention to the listening side of communication. Not that the message delivery isn't important, but I really do believe in the work that we've done over the last however many years bears that out, that when we listen to staff, they feel communicated with.
So let me ask you this, because one of the positions I like to take in hosting this show is kind of being that listener, the guy in the car or the gal in the car who's listening to this and having that question. And the thing that pops up to me, and it's probably because I've heard it before, is, all right, so I'm going to put myself in the position of telling my team members, hey, I want to be open door. Please bring me any suggestions or communication that you have around stuff we can get better. And then I inevitably have that team member that comes to me, gives me what they perceive as the most amazing suggestion ever. And it just doesn't work for us to either implement right now, or it's not going to be something that's going to be feasible. And so now that I don't take that suggestion, they have the attitude of like, well, why am I telling you anything then? Because you're not going to use it. How do I communicate in a better way to make sure that they know that even if I don't use what you're asking, I still want to know?
Absolutely. So, and I think that's really listening to them first in a non-judgmental way, even though you may, in your heart, say, there's no way this is going to work.
Sorry, we can't have clowns for every patient.
Exactly. But then talking through the why. If there are parts of the suggestion, so I'm a big fan of Simon Sinek, and start with why. And here's why this piece, but looking for as much as you can, is there a compromise? Is there a part of what you're telling me that we can implement? And really having that dialogue. And I found that folks, if you do that and you're respectful and it's clear that you've heard them and you've explained, here's why we can't do this right now. Most people are pretty respectful of that. Most people, if we start with the listening instead of, well, that'll never work. We can't do that because I found that staff and especially physicians hate most, well, we can't do that because of our policy. People don't care about policies. People don't care about people. People want to know that you've heard them, and people want to know that. So that's having that true conversation and being respectful. And if we can find parts of that suggestion that we can leverage and we can use, or maybe it's a timing issue. So I found that's a tough one. You're right. But I found that if they know you're sincere, and they know you've heard them, then that goes a long, long way in terms of helping them, even if you can't implement an entire suggestion that they have.
Yeah, absolutely. Just being, again, it's funny, we're talking about communication, about that open communication. Hey, thanks for the suggestion. Can't be doing that right now, or it's not going to work out this time, or, whatever, without saying no to then. And remember to keep bringing those to these. Great idea, very creative, whatever it might be.
Right.
You mentioned something that I would like to ask you your opinion on. You said that people want to know that you heard them. For the most part, what do people want? What do you think people want when it comes to their experience working inside of any type of healthcare professional, or really anyone in general, in your relationships, stuff like that? What do people want?
So I do think first and foremost they want to be heard, and you can draw from different authors and different research. I'm a big Daniel Pink fan too. I think his work, people want to feel like they can be at their very best, so develop that expertise. People want to feel like they have at least a little bit of control over the work that they do, have a say, have some kind of influence, and they want to feel like they're connected to a purpose that's bigger than they are. Now, in healthcare organizations, one would think that that should be pretty easy, but we sometimes don't talk about it enough. We don't as teams really talk about the significance, the magnitude of what we're doing every day, and how much of a difference it makes for patients and for families. And so I think I like Daniel Pink's research, and it aligns with our experience in terms of if somebody feels heard, if somebody and respected, then that goes a long way in terms of helping them be most engaged and most effective in their role on the team.
So you mentioned here look, we're in the healthcare industry for the most part. Many of the people listening to this are in some way in the healthcare industry. I mean, healthcare is being attacked right now, and in a big way when it comes to the service provided, when it comes to even just the perception of what's going to happen when somebody goes into any type of care facility, whether it be a hospital or it be a dental office. So as an employee, as a team member, how do you as a leader help me have hope for that future, have pride in what you do? How do you do that?
So I think one is I like stories. I like storytelling among teams and the phenomenal impact that we get. We don't celebrate enough when we have a phenomenal impact, and it doesn't even have to be enormous. It can be just being kind and being patient to somebody who's scared.
Love it.
I also think it's really important to remember, and I want to give credit for this. I was facilitating a workshop, an executive dialogue a couple of years ago, and the CEO of Banner Health in Phoenix was one of the major speakers. So Peter Fine, CEO of one of the largest, highest growth, most successful health systems in the country, but Peter struggled with cancer a few years ago. And so Peter went from being a CEO to also being a patient. Really changed his perspective on a lot of things. And I'll never forget, he was talking particularly about ambulatory practices, physician practices. He said, it occurred to me one day that you only need to ask the staff in a physician's practice one question to really understand what's happening in the culture and the practice. And that question is, who's your primary customer? And in respect for physicians, appropriately so, and for leaders in organizations, sometimes we don't emphasize to staff enough. Yes, I think it's great that you're helping me and that you're helping, the practice overall. But your number one job is to serve that patient and that family. And so often, we talk a lot about, I've stayed in healthcare my entire career because I'm humbled by the people that I get to work with in healthcare. I'm not a clinician. The commitment they have and the care that they provide. But our industry has grown up provider-centric, not patient-centric in the way that we're structured. And so we have to work on that all the time. And it's not that we don't care for an individual patient, but it is that often those policies and our practices are structured in a way that helps support us, honestly, more than it supports the patient. So I think having those conversations within the practice, being absolutely clear with staff about your number one bosses are those patients that we take care of. They're why we're here. And that's what's most important. I think those conversations are really critical for a team to have.
It's really interesting then, because if you look at it on a leadership principle, like I was saying earlier, right, the most important asset inside of a practice anyway is going to be the doctor, right? Because if he's not there, can't provide the service.
Nope.
So that, and then for the doctor, then his number one focus needs to be on building that team.
Right.
And then that team will deliver, and their number one focus should be on the patients. And so, like you just said, like don't turn back towards me as the doctor. Turn over to those patients.
Right.
Wow.
Exactly. And really try to put yourselves back to EQ. One of the is self-awareness, but awareness of others. And I'll make a long story short. And a lot of people have been there in our work with practices. Often patients do not leave a practice because of the physician or the dentist, or they leave because of the staff.
Yes. Oh, 100%.
And it can also stay because of the staff, because of the commitment and but the staff plays a bigger role than I think they realize. This is years ago. I was taking my son to a dermatologist, very, very, very well respected, waited a long time to get in, had to wait a really long time in the waiting room, really long time in the exam room. I was waiting for, I thought 3 hours was enough. I had a meeting that
Oh my gosh.
Yeah. And all I wanted was 2 words. I'm sorry. I'm sorry you've been waiting so long.
Acknowledgement.
An acknowledgement. And I never got it. And I get home and my wife says, so did you make the follow-up appointment? I said, nope, because we're not going back again.
No
I don't
way.
care how talented he is clinically. So that, those putting yourself into that patient and family's shoes and understanding what they're and if somebody would have just said, I'm sorry you've been waiting so long, that would have been great. I would have been cool. But they didn't. All they could say was, the doctor will be with you as soon as he can.
Here's probably the truth behind that too. What's sad is, those team members are frustrated too.
Of course they
Team
are.
members are sitting there going like, yeah, the doctor will be with you as soon as you can. What do we do?
Yeah.
And they know you're getting frustrated. It's interesting, just that little bit of acknowledgement. You can have, I tell doctors all the time, the thing you do, the commodity that you are selling,
right,
it doesn't mean anything. They can get it anywhere. I don't care if this guy's the greatest doctor in the world. There's another one who can deliver the same thing too. Whether you're an orthodontist or a dentist or a chiropractor or a physician, that thing can be delivered. So the only way to decommoditize what you do as a business owner is through that patient experience.
Exactly. And that relationship and that communication with the patient. Right.
You can even deliver a bad experience, like a bad service, right? A bad service if you have a good experience. I use McDonald's all the time. Like, I'm never going to have McDonald's sponsor me. I know, because I use them as obviously don't have a great product, but whatever that experience is, because you like something quick, you like to know that it's going to be the same thing every time. You enjoy the playland that you can send your kids to. Whatever it is, that experience has overcome a bad product.
That's right.
It's the experience.
And what if you pay attention to that? I use examples obviously in healthcare, but if I'm not in a hospital, I'm on an airplane. I spend a lot of time with Delta Airlines, and they're not perfect, but they've worked really, really hard in the last 10 years to improve their experience. And so they've built up this emotional bank account with me. So they're my airline now. And when they screw up, I'm more likely to say, well, today wasn't such a good day. But you know what? Last week was really, really good. And they were very accommodating and so we don't have to be perfect all the time. If patients know that we're doing the best we can, we're on their side, and we're trying to create the best experience possible for them.
Hey, the reason why I've been married 25 years is because I'm really good about making sure I have that emotional bank account built up for my wife. Like that one time I totally screw up. She's okay. Well, I've got enough in the bank deposit. Exactly it's the same thing in anything. It's a relationship. How are you building that relationship?
That's right.
So I would like to give 1 or 2 actionable items that anybody listening to this podcast can jump into tomorrow. What are one or two actionable items that they can do to increase their communication with their team members?
Give your staff more balanced feedback and err on the side of more positive feedback than negative or constructive criticism. And this is research-based. It's the 5-to-1 ratio. You may have heard. You strive for 5 times as many positive things to say with colleagues and with the team as 1 negative. And I think this is important, especially important for us in healthcare, because we're fixers. We tend to be diagnosers, so we look for the problem. That's what we're trained to do.
Absolutely.
And that's good. That's fine to look for the problem and try to fix it. So my suggestion to a team, look for in the next 24 hours an opportunity to see a staff member doing something. It doesn't have to be over the top. It's just, thanks for the extra time you took with that patient. I could tell he was really upset and he was really concerned. Thanks for taking a minute to talk. So she was waiting a little bit longer, and I noticed you were really good about keeping her updated. Thank you. That makes a huge difference.
Okay, if you say that and the person that you say that to has a little shocked look on their face, it's a good clue you're going in the right direction, because they're not used to hearing that from you.
That's exactly right. We do a lot of work on the inpatient side in hospitals. And one of our rules, if we're talking to a patient and we're rounding and they say something, and it's usually almost always positive about a staff member, we find that staff member, if they're working right then, and say, here's what Mrs. Johnson just said to you. I've had nurses almost in tears.
I bet.
Because we've stopped to say, here's the difference you're making for that patient and her family. And they're like, she said that? She said they don't hear it enough. And I'm humbled by what frontline staff in healthcare do every single day. If it's sincere, it's authentic, it's real, I don't think you can say thank you often enough.
We're going through an experience right now of putting my mother-in-law in an assisted living facility. And for sure, one of the things that we were looking at the most was, like, how does the staff like treat the people around it? How kind of, they don't know who we are, and how, right. What are they saying? And that's so important to have that, and to know that it's there. Right. You know, as healthcare professionals, most of them, and I think this goes for most people in general, especially if you're a mom, you are used to giving, and then that receiving part isn't something you're used to getting.
Right.
And so to have somebody and have a real concerted effort to give those compliments, to make sure people know, hey, I want you to know that Mr. and Mrs. Smith over here, they just said how amazing you were, and they loved your smile today. Right. That's so important, so encouraging.
Yeah,
so encouraging. Love it. Did we do two things? We did two things, right?
We did. The other one is listen more. You know,
okay.
The other one is and ask better questions.
Nice.
Go beyond just the question we all are wired to ask is, do you have any more questions? Well, that's a yes, no, closed-ended. The better question is, what other questions do you have?
Yes. Yep.
And reading the nonverbals, if we know they have other questions, but they're reluctant, then it may, well, tell me about, you know, how are you feeling about this change we're making? Or how are you, what are you most concerned about? What are your thoughts? More questions, more listening.
Love it, man. Bro, I could talk to you all day long. Like, this is just right up my alley. Anybody who's ever had me out at their practice before, has ever heard me lecture, I love the communication aspect of things. It's a relationship builder. I know you are aware of this with the Harvard study that came out, that 75-year Harvard study, right, where the number one predictor of happiness and success is the relationships.
That's right.
Well, you get relationships through communication. And understanding how to have that communication. Right. So can I ask, is the Healing Art of Communication, is that on Amazon? Can people go get that there?
Yep, you can find it on Amazon. And
awesome.
Yep.
We'll make sure we put that in the show notes as well, because we want people to run out there and get that information. I think it's no matter what your practice is, whether you're a small practitioner with just a few team members, or you are leading a big team, everyone can improve on the art of communication. So powerful. Well, so we've come to a place in our show, which is sad to me because seriously, this time has flown by. I ask 6 rapid fire questions, and this is just a back and forth, very quick. Are you ready to play?
I'm ready.
All right. So what do you think is the most expensive thing that practice owners are missing in their practice?
Loyalty. Patient loyalty is absolutely, it will kill you if you don't. If you're churning, and they usually don't tell you they're leaving.
Right.
They're quiet about it, but if they're leaving, patients talk to others if they're really, really happy and they're really, really upset, or they're really, really upset. And if they're really, really upset, they talk to a whole lot more people than if they're happy. So pay attention that loyalty is absolutely critical.
That's a great answer. Everybody comes with the tool. That's great. The loyalty is so great. What's a book that you think every private practice owner should be reading?
So recently I read Everybody Matters by Bob Chapman, who is the CEO of a great company here in St. Louis, Barry Waymiller, and he has really transformed the culture in that company. To their real purpose is to make sure they serve and support their frontline staff, because they know that's where the magic happens, and they know that will produce the greatest results for their customers. So I love his book. And then just real quickly, and this is an old one, it was published way back in 1996. I love the book Nuts, that talks about the Southwest Airlines story and how Herb Kelleher built what he did. And it has lots of advice on both business and personal success.
Love it. Awesome. Thank you. That we'll make sure we link both of those in the show notes as well. As you know, in my book, The Practice RX, I'm a huge fan of team culture and team performance, knowing that that is really the foundation to your business growth. You can create a magnetic office or business if you focus on those two areas. When you go to these doctors, when you are going into practices, when you are lecturing, what do you feel or see as the biggest challenge that most private practice owners are facing when it comes to their teams and their culture?
I'm going to go back to something I said a few minutes ago. And again, Peter Fine helped me see this, being absolutely clear about who the primary customer is for the staff. Yes, we have to take care of the physicians who are taking care of the patients, but we take care of the patients first. And we look at things through their eyes.
Know who your ideal client is. When I say know who your ideal client is, so I actually use the word avatar. You know how in that movie Avatar, you became that avatar, right? That main character did. You need to become them. What would I want? What would I want this experience to be like? So important.
Right. Yep, that's exactly.
So before we get to the last two questions, how can people reach out to you? How can they connect with you?
So I publish pretty often on LinkedIn. So I love for people to find me on LinkedIn. And surprise, surprise, there are not very many Burl Stamps on LinkedIn. But if you get there and we don't have, we're more than a couple of generations away, you'll have to have my email address. And that is burl@stampandchase.com. So you can put that in the notes as well. So that you'll need that if you're not, if you're more than a generation or two away from me on LinkedIn. But I publish a lot on LinkedIn.
It's Stamp and as in the A&D? Okay.
Yep. So Burl, BURL @stamp, like a postage stamp, and spelled out A&D, chase like the bank.com.
The only other person that is Burl Stamp on, that possibly could be on LinkedIn is a country singer. So you're probably good. No, I'm just kidding. I don't know. It sounds like a country singer.
It does sound like a country singer. Yeah,
that's what I thought. I was like, hey, there's a country singer. As I mentioned before the show, I'm very interested in names with my name. So, okay, this is a hard one, I know, but if you can think of just off the top of your head, what's the best advice you've ever received in life or business?
Focus on why. It's about the why and the how, not the what is where we all start. We should start with the why. And then secondly, it is, and this is trite, but it's a journey. There are going to be ups and downs, but as long as the ups exceed the downs and we have a generally upward trajectory, we're making progress.
You know, and think about it, a continual upward journey, that's hard. Like you need the downs. You need some inertia to get back up that hill, man.
You do. That's right. That's right.
The best resource or tool that you believe every business owner, private practice owner should be using to grow their business right now.
Okay, so I'm going to be really, really selfish here.
Yeah.
But at least I'm telling you that. So we've developed a framework for middle managers called My Team. And TEAM, it's another acronym, stands for great managers we think teach, they empower, they align, and they mentor. So you can find more about that. And we're wrapping up, but you can find more about that at my website. But that's a model we've perfected over the last 10 years. And we have just developed, we've incorporated that also into a very, very easy to use app to help managers implement those practices.
Teach, empower,
align,
and mentor.
Yes.
Love it. Love it. So important. Man, I use team more than anything as a phrase as opposed to staff, right? Because especially in the ortho and dental space, I always say a staff is an infection nobody wants, right? So you want a team instead.
That's exactly right. I like that.
So you gotta create that team of we all win or we lose together. So I love that acronym. That's great. I'm not gonna steal it, but I'm gonna promote it. So I
love that. I'd appreciate that. Thank you.
Well, everybody, all those links for Burl's website, for the book, all that will be in the show notes as well. But please go and support Burl. I think he gave us some great nuggets and some great advice today. And that's what we're all about here on the Propreneur Podcast, is just giving you those little things that you can work on right away. We're not trying to make things complicated. We're just trying to make things better. So thank you, Burl, for being a
Thank
part
you.
of that and sharing your information with us. We really appreciate it. You've been amazing today. For those of you that are listening to the podcast, please share it with a colleague that you know is out there that needs to hear this. You know, it's all about building a community. With the Propreneur Network, our goal here is to give people a place that they can talk about things that they either don't feel they have a space to talk about or were never taught and don't know where to turn. And so hopefully this will be that place for you to turn. Thank you, everybody, for listening, and we'll see you on the next episode, helping you be more proactive, productive, and profitable in all areas of your life. See you next time. Thanks so much again for listening to the Propreneur Podcast. We really appreciate your support. If you haven't subscribed already, please make sure you do so. Also, if you feel like you might be a good fit for our podcast as a guest or know somebody who you think would be, go ahead and email us at dino@dinowatt.com. Again, thanks for your support. We'll see you on the next episode.